Good
Good morning, everyone.
you for being with us this afternoon. I have the pleasure of being in the company of Dr. Tam, who is Canada's Chief Public Health Officer, and Dr. Nou, qui est l'administrateur en chef de la santé publique du Canada.
Chief Public Health Officer of Canada. Dr. Tam, the floor is yours.
Bon après-midi à tous. I'll start with the latest numbers on COVID-19 in Canada. There are now 98,787 cases, including 8,146 deaths, and 60,272, or 61%, have now recovered. Labs across Canada have tested over 2,152,000 people for COVID-19 to date. And over the past week, we've been testing an average of 33,000 people daily with 2% positive. Again, these numbers can change very quickly and are updated on canada.ca/coronavirus. Today, I just want to really remind Canadians that the reality is that COVID-19 is still out there and it will be with us for the foreseeable future. So as we get out more, I saw people going out on the weekends from our home and into public spaces. It's even more important to keep up with our now learned public health measures, including physical distancing and good hygienic practices, such as frequent hand washing and cough etiquette. For areas where COVID-19 is still active, it's recommended that you wear a non-medical mask or face covering when you can't keep that 2-meter distance from others. This is really important, and I've heard from my colleagues that younger people are going outside and may not be respecting some of these public health advice, so please listen to your local health unit. And even if you feel you're young and somewhat invincible, that is not the case. Young people have got sick, been hospitalized with COVID-19, and you can spread this virus to others. This virus is a bit hidden. It can transmit in a sort of stealth-like fashion in hidden chains of transmission, and you can then impact people who are more vulnerable as well. So that's just a really important reminder. So people across Canada have worked hard to slow the spread of COVID-19 by staying home and doing all these measures. However, home is not a safe place for many people experiencing family violence. Family and gender-based violence includes child maltreatment, intimate partner violence, and elder abuse and neglect. It has devastating consequences for children, women, families, and communities, and has long-lasting impacts on physical and mental health, and can affect future relationships and future generations. Today, June the 15th, marks World Elder Abuse Awareness Day. In 2018, more than 12,000 adults aged 65 or older in Canada reported violence to the authorities. And in about a third of these cases, the abuse was committed by a family member. There are concerns about an increase in family and gender-based violence in the time of COVID-19. Some jurisdictions have observed increases in reports of domestic violence, calls to crisis support lines, and demand for emergency shelter, while child welfare organizations have observed a concerning decrease in the reporting of child abuse and neglect. Measures necessary to slow the spread of COVID-19 are leaving some Canadians isolated with violent partners or family members. During the pandemic, typical community supports have not always been available to identify and support those at risk, including seniors. Asking for help can be hard, but I want Canadians to know that there are services available to help. If you are a woman experiencing violence, sheltersafe.ca can connect you with a shelter in your area. If you are a young person at risk or experiencing violence, you can call Kids Help Phone for confidential help and support. If you are in immediate danger, call 911 or your local police. If you're a healthcare or social service provider, you may be one of the first points of contact for a person experiencing family violence. It is important that you're equipped to recognize signs of family violence and to respond safely and effectively. The Public Health Agency of Canada has supported the development of evidence-based guidance and online education resources to help you recognize and safely respond to child maltreatment, intimate partner violence and children's exposure to intimate partner violence. The VIGA, Family Violence Education Resources, are free and publicly available on the McMaster University website. And these are available in a bilingual format. Family violence and gender-based violence are serious public health issues that affect children, youth, families, women, and communities. Remember that while many of us are at home due to COVID-19, not every home is safe. If you're experiencing family violence, know that help is available anytime, day or night. You're not alone in this. Thank you.
Thank you, Dr. Tam. Dr. Nu, s'il vous plaît.
Okay, merci.
Thank you. Hello. I will start with the latest numbers on COVID-19 in Canada. There are now 98,787 cases, including 8,146 deaths, and 60,272, or 61%, have now recovered. Labs across Canada have tested over 2,152,000 people for COVID-19 to date. Over the past week, we have been testing an average of 33,000 people daily, with 2% positive. These numbers change quickly and are updated regularly on canada.ca/coronavirus. Today, we also want to remind Canadians that COVID-19 is still present and will continue to be for the foreseeable future. We are increasingly going out into public spaces, and it is important to maintain good hygienic measures and physical distancing. Wash your hands frequently and cough into your elbow. In regions where COVID-19 is still active, please wear a cloth mask when it is impossible to maintain physical distancing. Throughout Canada, people have worked hard to slow the spread of COVID-19 by staying home. However, home is not a safe place for many people experiencing family violence. Family and gender child maltreatment, intimate partner violence, and elder abuse and neglect. It has devastating consequences for children, women, families, and communities. It has long-lasting impacts on physical and mental health and can affect future relationships and future generations. Today, June 15th, marks World Elder Abuse Awareness Day. In 2018, more than 12,000 adults aged 65 or older in Canada reported violence to the authorities. In about 1/3 of those cases, the abuse was committed by a family member. There are concerns about an increase in family and gender-based violence in the time of COVID-19. Some jurisdictions have observed increases in reports of domestic violence, calls to crisis support lines, and demand for emergency shelters, while child welfare organizations have observed a concerning decrease in the reporting of child abuse and neglect. Public health measures necessary to slow the spread of COVID-19 are leaving some Canadians isolated with violent partners or family members. During the pandemic, typical community supports have not always been available to identify and support those at risk, including seniors. Asking for help can be hard, but we want Canadians to know that there are services available to help. If you are a woman experiencing violence, sheltersafe.ca can connect you with a shelter in your area. If you are a young person at risk or experiencing violence, you can call Kids Help Phone for confidential help and support. If you are in immediate danger, call 911 or your local police. If you are a healthcare or social service provider, You may be one of the first points of contact for a person experiencing family violence. It is important that you are equipped to recognize signs of family violence and to respond safely and effectively. The Public Health Agency of Canada has supported the development of evidence-based guidance and online education resources to help you recognize and safely respond to child maltreatment, intimate partner violence, and children's exposure to intimate partner violence. The VEGA, or VEGA, Family Violence Education Resources are free and publicly available on the McMaster University website. Family violence and gender-based violence are serious public health issues that affect children, youth, women, families, and communities. Remember that while many of us are at home due to COVID-19, not everyone is safe. If you're experiencing family violence, know that help is available anytime, day or night. You are not alone in this. Thank you.
Thank you, Dr. New. Before we turn to questions, I would like to briefly summarize some of the announcements made by the Prime Minister this morning. First, on the Canada Emergency Business Account, the latest number indicates that a total of 670,000 small businesses have received a small business loan in the last few weeks. The Prime Minister announced today that on Friday, an application website will be provided to extend the eligibility for those small businesses loans. They will, in particular, allow small businesses that pay dividends to sole owners or that work with contractors or that operate in a manner which made them initially ineligible to the CEBA. Those small businesses will be able to apply starting on Friday. La deuxième annonce rapide.
Second brief announcement on artificial intelligence. The creation of a partnership, an international partnership on artificial intelligence, a partnership with 14 other countries, and we will be working as well with the OECD. We're focusing on artificial intelligence because we know that it can bring us further for sustainable development, economic development, and increasing productivity. But it also can allow us to protect, and we know what protecting health means in this pandemic. So we are going to continue to develop this and support this partnership and this center of expertise. It will allow us to do more in the context of COVID-19 and in the context of future pandemics.
Important announcement as well on the $50 million surplus food rescue program. Today is the starting date for the application to that program. That program is designed to support food producers and food transformers, as well as to support vulnerable Canadians, and as well as to reduce food waste. So again, the application for that important program is being launched today. Nous serions maintenant très heureux de répondre à vos questions.
We'll now be more than happy to answer your questions. Thank you, Mr. Minister.
Questions on the phone, one question, one follow-up, and then we'll turn to the room. Operator, over to you.
Thank you. Merci. Our first question, notre première question is from Hélène Bivetti.
Question from Le Devoir. Hello. My question is for Minister Duclos regarding the extension of the CERB. The Prime Minister stated that this will be happening, but why is it taking so long if all that is needed is to extend the date? Is this because the parameters of the program are going to change? Answer. What changed is the economic circumstances over the past few weeks. The CERB was created, as we know, to help freeze the economy so that people could protect their own health and the health of their loved ones. But the situation has changed over the past few weeks, and as you said, we had important discussions, and there will be an announcement shortly, which focuses on the new parameters You'll see it in the next few days. So how the CERB will be able to adapt to the current context, the sanitary and economic context. Follow-up question. In the past, to put in place this program, there needed to be a bill passed. So will you need to go through the House of Commons in order to modify the CERB? And if Parliament doesn't sit or stop sitting this week, will you be able to do this quickly enough so that people don't have to worry about a time where they won't be receiving their benefits? Answer: we'll have to be patient because the announcement has not yet been made. So details, legislative details will have to be given later. Thank you, Mr. Minister. Next question, please.
Merci. Our next question, notre prochaine question, is from Sharon Kirky with the National Post. Please go ahead. À vous la parole.
Hi, thanks for taking my question. Talked about a review that he's commissioned of the 2-meter physical distancing sort of edict, and Quebec today said that it's reducing its physical distancing requirements for children 16 and under, and it's also going to reduce it to 1.5 meters in places that people don't frequently talk to each other, like movie theaters. And Canada is one of only a few countries that recommend a 2-meter physical distancing space at the federal level. Could you tell me what that Canadian guidance is based on, and are you looking at whether that can be relaxed somewhat?
I think, as everybody knows, we're still learning about the virus, and we absolutely should be reviewing evidence as we're going along and adjusting guidance accordingly. What we do know is the virus is primarily spread by people who are close to each other, coughing, sneezing, even speaking, shouting, even talking. And the larger respiratory droplets, for example, will fall and closer and quicker to the ground. We know that if you maintain a distance of 1 meter, you can avoid some of these droplets, perhaps the majority of them. But 2 meters distance means that you can avoid some more of these droplets, perhaps landing on you. So I think it's a matter of a gradation of risk as well. At the same time, of course, we've advocated for other measures that can be layered on top of the physical distancing measures, including, for example, the wearing of masks if people can't keep the 2-meter distance. So because it's a multifaceted approach, people have to sort of evaluate the environment, the context, who is in that environment, and do a proper risk assessment. But the bottom line is that, 1 meter can help avoid some of those droplets. 2 meters will be a bit better. And so some of it is maybe about feasibility in certain settings. So I think it's a matter of a risk assessment approach, which we've been advocating. But we will continue to learn and see what actually happens should people reduce these measures, but absolutely maintain all the other measures as well. You've got to do that. So I look forward to ongoing sharing of best practices as well as evidence with the other chief medical officers.
Follow up?
Thanks. My other follow-up, and you talked, Dr. Tan, about those other measures like wearing of masks. And a group of Ontario doctors is really urging the federal and provincial governments to mandate mask wearing in an attempt to slow the spread of SARS-CoV-2. And why have you not mandated mask wearing in public indoor spaces like grocery stores?
So again, in a discussion with other chief medical officers, they emphasize that people have to listen to local public health and know what the virus activity is in the community. Some communities haven't experienced community transmission. Others clearly have and continues to experience virus transmission, even as cases come down. So they would like to exercise that flexibility according to evidence and data in their particular community. At the national level, we agreed to recommend the use of non-medical masks in the context of communities where the virus is still circulating or have recently circulate in areas where you can't keep that physical distance, particularly indoor enclosed spaces, grocery stores, public transport. And so that is a matter that is being determined at the local level.
Thank you, Dr. Tam. Operator, we'll take one last question on the...
Thank you. Merci. Our next question, notre prochaine question is from Michel Lamarche avec TVA Nouvelle. Please go ahead. À vous la parole.
Question from TVA Nouvelle. I have a question for Minister Duclos. Mr. Duclos, we understand that announcements will be made this week on the CERB. Why can't you just reassure people that it will be extended some way or another for those? Thank you, Michel. We know that there are a lot of questions and a lot of anxiety regarding the CERB. The CERB had a significant impact economically and socially. Without the CERB, the economic situation would be dire and we would be facing a significant social crisis. So we know that there are a lot of questions and a lot of anxiety. This morning, Mr. Trudeau reminded everyone that we will always be here to help those who need it, those who are the most vulnerable, and there will shortly be an announcement on that. A follow-up question, Michel. Mr. Duclos, you can't even tell us today that you're going to extend the CERB. Everyone's waiting for this announcement. It's supposed to come this week. Can't you just tell us that it will be extended, even if you don't have a specific time frame to confirm today? Answer. I think that you can read between the lines. When Mr. Trudeau said that we're going to be there for Canadians, it means that something is going to be announced. But we want to do things properly. So it's not only a matter of extending or changing or adjusting this, or people want to know exactly what's to come. And that's why we still need a few more hours, perhaps a few more days, so that we can make sure that Canadians understand what Mr. Trudeau said this morning when he said that we were going to be there to take care of everyone, including people facing economic challenges. Thank you, Mr. Minister.
Mr. Lundgren from Reuters.
Yeah, a couple of questions for Dr. Tam. We're about to hit 100,000 cases. Canada is 12th on the list in the world for number of deaths, 17th in the list for number of deaths per 1 million population, which suggests that things haven't gone brilliantly. So first question, if you had to give a report card to all the efforts done in this country so far to tackle this, what would your report card be?
So I think as we come down the sort of side of this first wave, it is good time to take stock of lessons learned and how we've done. I think Canadians have done an amazing job in all of their efforts to practice physical distancing, staying at home when they were asked to do so, and trying to learn all of these new hygienic measures and keep up with it. So we need to have a sustained path forward so that these become actual everyday practice, so that that can be sustained, because we know that this we have learned more about how this virus is spread. I think that in Canada, of course, one of the biggest lessons learned is about who is most severely affected in the vulnerable populations. And in particular, I think our first wave of epidemic really impacted seniors and those who live in seniors' residences or long-term care facilities. So that's got to be the biggest lessons learned for Canada, and where much has began, but more needs to be done to ensure that that doesn't occur and that best practices in place. Infection control, living and congregate living, and how we treat our seniors in general in society. And that is a responsibility for governments, but also for all those who manage long-term care homes and also society writ large. The other aspect of, I think, where spread has occurred more rapidly and accelerated in other vulnerable settings. So we've got to learn from those work settings, for example, which include more crowded spaces, but congregate living spaces for workers, workers who are not paid well enough and they have to transfer between facilities. All of those things is what has, I think, driven some of the bigger clusters and outbreaks in Canada. And we need to have learned from them. And so that as we move forwards, that the surges in cases doesn't happen again, because we've learned all of those things, which I think some of the other countries have learned as well. So particularly some of the other European countries who may have some similar setup in terms of their elder care and also some of these workplace phenomena. So I think what we have done is, with everybody's help, flatten to the curve to the extent that we did not overwhelm our acute care system, but we certainly did not do well in the sort of long-term care senior setting.
And secondly, looking to challenges ahead, you mentioned concern that some young people are being complacent about mask wearing. I'm thinking of what you've mentioned about old care homes, horrifying spike in cases in some US states. Looking ahead, what are the main challenges to you as you and your colleagues continue trying to handle this? And how do you quantify the seriousness? Are these hiccups that can be dealt with fairly easily, or is there the potential for one or more of these challenges to really knock you off course?
So we continue to learn about this virus, and I think the fact that we've learned about how this virus could spread in a hidden way, people with very mild symptoms or sometimes no symptoms at all, which could be the case in younger populations, is that people will forget as the number of cases come down, and which is great. But I think it's the sustainability of our response going forward that is going to be really tough. So we will just have to keep reminding people, maybe use behavioral science and visual cues as to, well, how do you keep that physical distancing? You've seen in parks where people draw circles, or people have lines on the ground to remind people how to keep physical distancing, because it's not easy to sustain that kind of approach in people's minds. But it's really, really important because the virus hasn't disappeared. We have probably low immunity in the population. We are still going to be doing those serological testing to see what the prevalence is in the population. But the virus has not gone away. There's a misconception, I think I got asked the question last week, which was, well, has the virus changed? Is it less severe or less transmissible? Well, no. The cases are coming down because of the public health measures that we've done, not because the virus itself has changed. It's the number of cases reduced because of all of those things that we have put in place. So I think together with the chief medical officers, we're trying to think, well, what are the sustainable measures that we can keep going, while at the same time, the key is to build up enough public health capacity and healthcare capacity to essentially clamp down, detect and clamp down on any cases and contacts. So some of our collective readiness measures to reduce resurgence is related, as everybody has heard, increasing laboratory testing capacity, increasing contact tracing abilities, and making sure people have a safe and appropriate place to quarantine and isolate. And so you will see those measures continually to be built up, and we are certainly, one of the scenarios we're preparing for is a potential surge in cases come the sort of fall and winter season, and plan that ahead, and also plan for a scenario, for example, where influenza might be circulating at the same time. So I think what we're asking all Canadians to remind themselves is it's not normal times. We're not going back to before January 2020, and that everyone, including young persons, must follow local public health advice.
Thank you, Dr. Tam. Mr. Aiken.
Thanks. Hi, David Aiken, Global News. Minister Duclos, question for you, a couple of them about our access to information system. So this morning I filed a routine request to a federal department. I asked for a briefing note, 10, 20 pages long, identified by the departmental tracking number. And here's the typical response I just got. We are requesting your consent to place your request on hold temporarily. It's a very common response. What would you say?
Well, I would say three things. First one is I understand what you say, and I can also feel how frustrating it must be for you and for many other journalists to get that type of answers, because you have a very important role to play, and for that role to be played, you need the input that you need. The second thing is we understand also that for the public service, that the times are challenging. Many of them are living in an environment where it's more difficult, given current technology, to have access to the information that they need to support your work. And that's in large part because, as I said, because of technology. The technology that is still being used now in the government of Canada is a technology that makes it difficult, even in normal circumstances, to respond appropriately and quickly to the type of requests that you make. The third thing that I would say is that we will be entering very soon into a review process around the access to information law and the associated changes that we'll need to put into place. I've already discussed with the Information Commissioner a couple of important things that she has on her mind, and we look forward to working with her and with many others to improve the quality of the services that you receive.
Thank you. Noting how common the phrasing is, the response is across all government departments, particularly the major ones handling access to information requests, and given that every department looks to Treasury Board for guidelines on processing ATIP, it seems impossible not to conclude that there was a memo coming from you or your deputy to ATIP functions across departments, forgiving them of their obligations under the Access to Information Act, so far as timeline goes. I wonder if you can talk about that, and also talk about what instructions do you have for them now to clear the backlog, to get these workers in our government back to work, just as we are in broader society, to fulfill, again, the obligations under a law.
Yeah, well, there are two things in your line of questioning. The first one is about a memo, and there was indeed a guideline sent by Treasury Board and myself in particular to public servants just a few weeks ago, reminding them of the information to do the important job that they need to do to support your work. And despite the emergency circumstances, that job must continue. And the second line of questioning is around the fact that there might be a view that we are not taking this as seriously as we should. I think this, although I understand again the frustration that you would feel, I can assure you that Treasury Board has made clear, and public servants everywhere, I think, have clearly understood that they need to continue that important job. We hope that despite the possible length of the pandemics, it will become easier and better to get that information. And as I said, there was a longer term agenda to improve both the technology and, to be frank, the attitudes of governments in that particular area.
Thank you, Minister. Olivia.
Good afternoon. My questions are for Minister Duclos. I understand, of course, your government says today that it's looking at ways to extend CERB, but I'm looking for details about how you're working on a plan to transition millions of people off this program. How exactly will your government decide when CERB can end?
Well, transitioning is the key and the right word. Initially, transition was not in our minds. It was important, as I said in French earlier, to make sure that people had the ability to stay home and still to put food on the table. But there comes a time, and the time has now arrived, where we do indeed must think about transitioning, because some sectors of our economy have already started to transition, and the CERB, like other social support programs, must be there to support both workers and job creation. So the overall environment, I would say, is a changing one. It's a rapidly changing one, where we must indeed take into account the social impact of CERB, very significant. There would be a significant, severe social crisis now if CERB had not existed. The economic crisis, which CERB is indeed helping to reduce, and taking into account the technological challenges. You know that had we relied on the EI, the employment insurance system, in April, it would have taken almost 2 years for the 8 million Canadians to be given support. So that obviously wasn't wasn't possible at that time. So while we envision transitioning, and we'll be, as I said, announcing important things around that in the next few days. The Prime Minister said that this morning. There will be, of course, connected to that announcements as to how we will make sure that the technology supports that transition.
Is your government considering any specific options that would remove powers and defund police?
Well, this is, of course, part of a very broad and important discussion that we must all have, including the police force. And I think, again, the Prime Minister has made quite clear his views on that just last week. What he also said, and what I could perhaps remind everyone of, is that there are other ways of, in addition to making sure that the police forces have both the right signals, the right expectations, the right obligations, and the right tools to work with and on. There are also many important measures that the federal government can use, and I would signal that one of them is through the public service. The public service has diversified over the years, but I've looked at the recent numbers, and we need and we can do a lot better. So with the clerk and with my colleagues around cabinet, we'll be looking carefully both at the numbers and what we want the situation to be in the relatively short term.
Thank you, Minister. We'll just go back to the phone before we turn to you, Kevin. So, operator, next question, please.
Thank you. Merci. Our next question, notre prochaine question. Avec Agence QMI, please go ahead. À vous la parole.
Question from Agence QMI. My question is for Mr. Duclos. If I understood correctly, today there's an announcement to say that there's going to be an announcement in a couple of days. For those at home who are having anxiety, who don't understand, you say that you recognize that they have anxiety, but then you say to them that they need to read between the lines. How can these people feel reassured today? Answer. The important word is reassured. That's what Mr. Trudeau did. He reassured people that he will help them. We haven't given details, but it will be coming shortly. Over the past few weeks, one can see what we did, and it clearly shows that we responded quickly and effectively to help everyone. And Mr. Trudeau said this morning that we will continue to help people. Follow-up question, Emilie? Yes. So Wednesday, there will be a study of additional credits. As chair of Treasury Board, this is a new file. The budget for the CERB was seen to be higher. Extending the CERB, and you don't have any details, but what will be the impact of extending the CERB? Will you have to increase the CERB budget again? Answer. As you mentioned, I should have been aware of the supplementary estimates. It's my job to be aware of this and to follow it carefully. But what is going to be tabled on Wednesday has two components. The first one being statutory. So this is something that needs to be voted on. The statutory component is the big component of what's coming on Wednesday. This component was adopted by the House of Commons when it put in place the Canada Emergency Response Benefit. The federal government's capacity to fund the CERB and what's to come already taken into account by the statutory element, but on Wednesday there will be an important discussion on other things that have not yet been approved by the House of Commons. Thank you, Mr. Minister. Next question, please, operator.
Thank you. Merci. Our next question, notre prochaine question is from Jim Bronsko with the Canadian Press. Please go ahead. À vous la parole.
Good morning, Mr. Duclos. You hinted a moment ago that one of the things you're looking at is increasing the diversity of the public service. The Prime Minister spoke this morning in the same vein about things that could be done in the relatively short order, that he was consulting with communities. The government is looking at things it can do relatively soon in fighting systemic racism and making changes. What are some other examples of what the government is looking at?
Well, if I may come back quickly to your first point on diversity in the public service. The first deputy minister, the first black deputy minister, was nominated just a few months ago. The first black chief of staff of all governments at the federal level was nominated by myself just a few months ago. So she and it's both in both cases these are women, black women. I think they demonstrate that with many others around the public service that we can do better. Now these are both important but still modest achievements. So we have a lot more to do. At the public service level, it's particularly among the higher level public servants that the lack of diversity is more present, and where the absence of black public servants is noticeable. Outside of the direct public service, I may also add that we have made some important progress in the last 4 or 5 years. For instance, the percentage of nominations of black Canadians, nominations made by the federal government, has doubled from about 4 to about 8% in the last 4 years. So this is good. It's not enough yet, but we will be working obviously very hard to improve that. Now, more broadly, what the federal government can and should do is to help others remove barriers, because it's all about barriers. It's barriers that are either seen by others or not seen by others. And for these barriers to be seen by others, I would use the image and the sentence of the Prime Minister when he says that it's sometimes difficult for people like me in particular to understand and see and feel the barriers felt by others, because I'm a relatively privileged person. I haven't suffered from discrimination. So it's all about empowering everyone, not only black Canadians, empowering everyone to see the barriers that others are facing. And as elected officials and as more generally as citizens, we do have both the ability and the responsibility to help.
Jim, follow up.
Minister, just thank you for that. Just can you provide us with some examples of what you can do to help remove those barriers you just spoke of?
Well, you mentioned very briefly, you heard about public safety, education, to make sure that, as I mentioned earlier, the public service is barrier-free. My colleagues with Indigenous Canadians, obviously, my colleague, Minister Chagger, around diversity and inclusion, because in Canada we're very proud of our diversity. It's our source of strength and pride, but with diversity needs to come inclusion. There are so many other fields, some of them in the domain of provincial jurisdiction, in which the federal government can have either a direct or an indirect influence. And to be honest, the Prime Minister has already engaged all of us in the last 2 weeks, has asked all of us to work very quickly and very efficiently in coming up with a way forward.
Thank you, Minister. Operator, next question, please.
Thank you. Merci. Our next question, notre prochaine question is from Lina Dib with La Presse Canadienne. Please go ahead. À vous la parole.
Question from La Presse Canadienne. My question is for Mr. Duclos regarding the CERB. For weeks and months, the wage subsidy doesn't have as much use as you would have hoped, and by extending the CERB, are you not making the situation worse for the wage subsidy? Answer. There are significant changes. The wage subsidy, for reasons that I could describe later if you'd like, the wage subsidy again started slowly, but has seen significant uptake in the past few weeks. Between 2.5 and 3 million Canadian workers are being supported by the wage subsidy. Another significant change has to do with the CERB. About 20% of Canadians are no longer receiving the CERB because they no longer need it. They were able to go back to work. And we expect that with economic restart, and we've been able to validate this with Statistics Canada data, people will be going back to work. But you're right, we need to modify the CERB in order to make more space for the wage subsidy and for other eventual measures so that the disincentive measures do not slow economic growth. Disincentivizing work will become a problem. It was important socially at first, but now there's a more significant need for the wage subsidy for economic growth. Follow-up question. So there needs to be adjustments to this CERB in order to make more space for the wage subsidy. In the next few days, there will be announcements. We're not only talking about the number of weeks one will have access to. There should be a change in criteria. Answer. That remains to be seen. And again, the situation has evolved significantly. The CERB and other measures thus also need to evolve. Thank you, Mr. Minister. Kevin?
Good afternoon, Kevin Gallagher, APTN National News. My question here has a little bit of a government focus and perhaps a public health focus, but it does have to do with the CERB. But part of the issue that is a challenge to encourage Canadians who have taken advantage of this, have used this program, let's not say take advantage, have used this program because of the serious circumstances that we're in. Many are have serious concerns about returning to work for a myriad of reasons. Perhaps they're not convinced that the policies at their workplace are up to the public health standards they like to see. They may have or live with someone who is immunodeficient. And in other cases, they may be getting paid more on the CERB than the job that they could go back to will pay them. How does the government meet the challenges to encourage Canadians to leave this program given all those factors, and what public health measures need to be in place for employers and employees to ensure that there is the utmost safety to control any type of future spread or second wave, that sort of thing, to ease the collective minds of Canadian workers as they head back to jobs they may be concerned could increase their chances of becoming infected?
Well, very quickly, because I'll turn immediately to Dr. Tam, because you make a very important connection between the health and the economic conditions. And exactly that. No, at the beginning, CERB was there to connect these two in a manner which we had never thought about, because that was the first time ever that the Canadian government had to reflect upon how to protect the health of Canadians and the ability of Canadians to make ends meet. But now we are moving into a different world, and I'm going to ask Dr. Tam to answer the question.
Yes, so with the Chief Medical Officer of Health at the Special Advisory Committee, a considerable amount of time was devoted to providing guidance for workplaces from the perspective of a risk assessment-based approach. There's so many different workplaces, and each of them are quite different in terms of the actual physical environment, the people who live or work in that environment, and their not just that, but their connection back to their families, who's in their families, whether they're living in crowded conditions, for example. So there are many guidance already provided, and you can find that on our websites. Also working with other sectors, because each sector actually, many of them have got best practices and ways that they are providing all the public health measures that is required at the local and municipal and provincial level. The Canadian Centre for Occupational Health and Safety, where for many different sectors, some of these guidance are provided so that they can safely reopen. As employees, of course, you need to talk to your employer as to how they're protecting the health of yourself and the workplace. And the same with the federal government. Right now, we're trying to make sure our workplaces are sustained in a safe manner. Learning and actually capitalizing on some of the positive things that have come out of the last few months is leveraging some flexible work arrangements if you can. Things like teleworking, how to do different shifts and have people come in at different times. So there's quite a lot of ideas and different approaches that employers are using. And so more and more of these tools are available. So the support for the Canadian Centre for Occupational Health and Safety is meant to try and pull all of that together so that people have the resources they need to return to work safely.
Really, I think this will just focus for you, Minister Duclos, this transition that the government is keen to encourage from the emergency relief benefit to the wage subsidy. Many businesses seem reluctant to join on to the wage subsidy program, and there again are a myriad of reasons there as well. There are a lot of expenses for businesses to reopen to meet the public health guidelines. They anticipate fewer customers because of those guidelines, and therefore may not be able to hire back as many workers, or choosing to scale down, or may not be able to reopen. At this point, there's just a bit more than $10 billion of wage subsidy that has been paid out. Of course, when this program was touted, it was, the biggest public health economic development type program since the end of the Second World War, more than a $70 billion anticipated budget. What more can the government do to encourage businesses to sign on to the wage subsidy? And has its uptake been a disappointment thus far for your department and the government?
Well, disappoint the right word. I would say it's in the matter of adjustment. The firms some weeks ago were facing two types of uncertainties. The first one was around the nature of the program itself. Now, it was the first time ever that the government of Canada had designed such a program. And second, firms were uncertain as to their ability to proceed, at which speed and in which manner with relaunching their business and rehiring their workers. So there was an understandable lack of speed initially when that was introduced. Now that is clearing up. I think businesses are understanding better how this system works, and businesses have a better ability to see the way forward, economically speaking. In addition to that, the Minister of Finance, Minister Morneau, as you will know, is working very hard and has received very good pieces of advice from the business and the worker communities on how to make, as you said, the wage subsidies more impactful. And he will have something, I believe, quite good and useful to announce in the near future.
Thank you, Minister. Ceci met fin à la conférence de presse pour aujourd'hui.
This concludes today's press conference. Thank you.